Chamberlain and I were great friends, and I want to just take a minute to remember her. She was so influential in part of the development of the National Empowerment Center, and I miss her greatly in the time since she has passed. And she was, as you know, a great orator and a great writer, and I am neither. So I'm going to borrow some of the words that she wrote. So if we go back and try to remember what it was like in the 1990s when the National Empowerment Center started. In 1990, there were no peer-run technical assistance centers. There were none, like zero, okay? And Judy said that at that time, many groups exist that claim to speak for patients, including the American Psychiatric Association and NAMI, but that a basic liberation principle has always been that people must speak for themselves. And that was the basis for the development of the National Empowerment Center. And also I wanted to acknowledge SAMHSA, because SAMHSA, the Substance Abuse Mental Health Services Administration, say that 3 times fast, saw the need for a policy change that would bring people with lived experience to the table in mental health, although it's not called mental health anymore, right? It's called behavioral health or who knows what. Anyway, so I just want to acknowledge that the Center for Mental Health Services was the organization, the federal government organization, that funded the first technical assistance center, and that was the National Empowerment Center, along with Joe Rogers at the National Clearinghouse. And now there are 5 National Technical Assistance Centers in the United States. When I brought a group of Dutch psychiatrists to the Center for Psych Rehab to introduce them to psychiatric rehabilitation and the principles of empowerment, etc., and I invited Dan to come and share his story. And the Dutch psychiatrists were very polite. I don't know if I ever shared this with you, actually.
After what's coming.
Yeah. But it was a pivotal moment for me, because after Dan left, they said to me very politely, "Oh, he's not a person with mental illness. He couldn't be a person with mental illness." That's what they said about Dan. Not possible. Those 2 concepts don't go together. The fact that you could be a professional, let alone a psychiatrist, that you could run a mental health service and have lived experience were 2 concepts, particularly for this group of Dutch psychiatrists, that just did not compute. Just Dan being willing to share his story with that group of Dutch psychiatrists has made such a tremendous difference, not just in Holland, where those people went back and started the seeds of a recovery movement there, but also around the country. His willingness to step out and to say what he thinks and share it in a loud and clear voice has really made a difference in the United States. You know that Dan came to the center because Larry Cohen and Dory were recovery education teachers of one of the people that Dan was serving. And that individual took his own life while he was a student at the Recovery Education Center. And it devastated Larry and Dory because they were very close to this person. And Dan came to Larry and Dory, to help us heal from this loss. And then he stayed. And not only did he help us recover from losing this individual, he helped us recover as clinicians, so that we really learned with his guidance as our clinical supervisor how to support the healing of people from their experiences.
Our empowerment center started right at BU Center for Psych Rehab. And I'm sorry that Pat couldn't be here. Pat Deegan is another person, Patricia Deegan, who played a very important role. And I was reminiscing with her today about it. And she and Judy and I, in 1990, we were all 3 of us consulting at BU. And it was Pat's idea, really. She said, well, let's just the 3 of us get together, and Dale Walsh also. There was a fourth consultant. Let's get together and start meeting. And you know, that's how our movement really started. Just a few people getting together and meeting. And then I said, you know, so what's up? What's the idea? She said, you know, what we need is the equivalent of a Stone Center for women. We need such a center for people with lived experience of recovery from psychiatric disabilities, or whatever we're going to call it today. But anyway, ex-patients at that time. And I remember thinking, that's a nice idea. How do you do it? we didn't have resources, but we just started meeting. And I encourage any of you that haven't already done it, or those of you that have done it some, if you have an idea, and it's a good idea, and you have people of passion and people who share your values, just start meeting together. And something is bound to develop, something very important. And we met several times, and then lo and behold, one day, Bill Anthony walks in. I remember him throwing it down on the RFP for a grant, throws it right down on the table and says, "You smart young people," we were young then, sort of, "Here's a RFP for a grant for a technical assistance center." And we're like, yeah, who wants to do a technical assistance center? That sounds really very dull. No, he said, this is an opportunity. This is what you want to do, right? Well, we said we want to do the Stone Center for women, only for, people with lived experience. We didn't think technical assistance center, what's that? And he said, just try it. Just try it. When I was preparing for this, Oryx Cohen, our newest addition to the Empowerment Center, said, so how about the future? Enough of this stuff about the past. How about the future? So that was really very helpful. And I thought, what would I really like to do and see NEC do in the future? So we have a new brochure, as you can pick up out there. And this is called Community Dialogues for Recovery and Wellness. And the idea behind this is that we have been sort of talking to ourselves. And, we're good at talking, in our own small circle. Those of us that have been through recovery, those of us that are allies. But we haven't gotten very far out. We're starting to, thanks actually to Bob Whitaker and his book, and thank you for being here. Anatomy of an Epidemic. Anybody hasn't read it, should be required reading. It is just excellent. And that book has started to capture the more general public. And there's a recognition the epidemic, as people probably are aware, is the epidemic of psychiatric medication. It's just, and even people who before had thought, well, maybe it's okay, are starting to question it. So this is a little bit of our entree. So what I like to do is to start to establish these dialogues out with the general public. And I found sometimes the most interesting talks that I've been involved in were, now I realize, dialogues. I never really called them that. But if I say a couple of years ago went to Hartford, Connecticut, and did a fundraiser for Richard Schulman there, who does volunteers for psychotherapy, I said, let's just have a hall and bring people in. 200 or 300 people came, and we spent a couple hours together just talking. That's really what it is. And these problems in our society about forced treatment, about rights, about medication, about diagnosis, you're seeing them more and more now, in the news and New York Times, and they're not always the greatest articles, but the idea that I would like to see is that we train people, and we started to do this actually, people who have experience first, and we do a course called Voice and Dialogue, and I see there are a couple of recent graduates there, and training people really to speak up and to engage in dialogue and to engage other people in dialogue. And it's really an attempt to help heal and help explain what it's like to be in different worlds. What it's like to go through recovery, and what it's like to be a provider. I have a personal stake in it because I've been living in both worlds for a number of years. My belief is that if we do that, we can come up with new ideas. And family members as well. And in Ireland and Germany right now, they have something called trialogues. And family members, providers, and people with lived experience just get together periodically. And I even heard them talking about a new program of ours which I also recommend emotional CPR, which is a type of dialogue just one-on-one to help people through emotional crisis. Because we're in crisis. This society is in crisis. Now I'll tell you why the hat is on here. So I'll just give you a small illustration. So there's a group last month at Riverside Community Health, which is where these started, and Sabine has been helping out a great deal there. So our idea, always we say, is leave your hat at the door. Everybody leave your hat at the door, so that everybody's as equal as possible when we start the dialogue. So I walk in, and there's a woman who's been a client of mine. She said, "Oh, Dr. Fisher, hello." I said, remember, here's my hat. It's at the door. I'm Dan. Okay, Dr. Fisher, no. It's hard to get beyond labels. It's hard to get beyond roles. What we want to do really is, and anybody who wants to help out in this, you're welcome to stop by after the play. We can chat a little. I believe that we really, really need these dialogues. It's extremely important. We're in a crisis point, I feel, really, in our services. And people are angry at what they're getting. They don't want to be locked up anymore. It's a dreadful experience. Our rights are being abused very frequently. But on the other hand, we have to have alternatives. We can't just say, don't lock people up. What are you going to do? So we need to bring in things like open dialogue, actually, from Finland. There are alternatives that are very successful. I've worked out an arrangement with this Foundation for Excellence in Mental Health Care. And we're starting a fund, and the fund is going to be called Community Dialogues for Recovery and Wellness Fund. And I think it has to, initially these changes have to come from private philanthropy. In this case, the NEC is linking up with a community foundation, this Foundation for Excellence, which actually was inspired by Bob Whitaker's work. And through this foundation, we will put out our ideas. And anybody has any ideas of how to reach the people who might finance something like this, just stop by after the play and talk with me. And I'm told that we should aim high, not low, but high. We should look for an endowment is what we really should look for. Because these ideas, I want this work to go on for the next generation, for my children, for everybody.
It's been a wonderful life experience to go from having had the experience of being inside a mental ward to being out for a long time and talking to tons of people who are thrilled that there are many of us who are out and have found full and complete lives, which I'm thrilled I have. I get the honor today to honor Carmen Amill, who's worked at the National Empowerment Center since 1996. For 16 years, Carmen has come to the office almost every day, and she holds down the fort, literally. There are many examples of people who have called. In fact, I would literally say dozens, and I don't answer the phone that many hours, but who have said that Carmen made a difference in their lives. I think all of us have heard this when we're on the phone. And I want to just give you one quick example. A father called a few years ago, and he was just ecstatic. He's like, I just want to tell you. He's like, is Carmen there? I was like, she's not here right now. Well, I have to tell you. He said, years ago, we called National Empowerment Center, and Carmen answered the phone. And in fact, we called back quite a few times that year, and she kept being willing to talk to us. He said, Carmen literally changed our lives. He said, my daughter was at that point experiencing her first hospitalization. She was being called mentally ill. She was going through incredible stress. He said, we talked with Carmen. She gave us a new way of looking at the experience. He said, then when we went to the hospital, we started asking questions of the staff. And one nurse, just one nurse said, keep looking for answers. There are different ways of looking at this experience. And he said, in fact, there were other possibilities for my daughter. My daughter found those different possibilities. She no longer believes she's mentally ill. She's graduated from an Ivy League college with honors. And I wanted to call and thank Carmen and thank all of you at NEC.
I just want to say thank you to, I don't call them my, for me they're my family. I've been there for a long time. Dan's been really great with me. He even changed my grandson's diapers. So it's not a job there, it's a family. I find it that it's my family, and that's why I'm there. Thank you for everything.
So, in order to get into Alcoholics Anonymous, you've got to have something wrong with you. And I found the same when I interviewed with National Empowerment Center. So, it's the first time in my life they all sat there giving me rapt attention as I told my drunkalogue, which is what we call it in AA. And we talked about the horrors of my life as an alcoholic and about the life I've led ever since in recovery. And I have to say it was the weirdest job interview I've ever had. So here I am 4 years later. I've learned things about the system that I really never wanted to know. But I've also been able to contribute to people's recoveries and people's lives through the work that we do at the National Empowerment Center, something that I didn't find in corporate America. I appreciate so much being a part of an organization that believes in humanity, that wants to contribute to people finding and using the power that's inside of all of us, that understands that, and an organization that has made a difference in the world. Oryx asked me to talk a little about what I see as the future, what I'd like to see happen. And in the future, I believe we'll continue to effectively educate people, all people who have people in their lives, to stop looking outside ourselves for something, anything that will make us feel better or change our circumstances. I believe we'll continue to offer tools and information, training and support that empower people to gain control of our lives and control of ourselves and live life on our terms, lives of recovery, whatever that means to each of us. I hope we can begin to find ways to empower parents to understand and guide their children rather than to squash them, control them, and buy into the belief that there's something wrong with them. And also to empower kids to be strong in who they are, even if it's way different from what appears to be normal. I'm so grateful to have found or have been found by this organization and this amazing group of people. I've been really grateful that National Empowerment is an organization that encourages me to be myself and live my life and show up at the office on a regular basis. I also want to say thank you to Carmen, my friend. You've helped me and supported me more than I can express with words, and I love working with you every day. Thank you.
Leah Harris. I'm the Communications and Development Coordinator at NEC, and basically I do everything that involves words, audio, video, whatever they need me to do. I'm there with the communications and the social marketing. I just want to briefly talk about the happy accident that led me to NEC, and I do have a point with all of that. But basically, right before I discovered NEC, I was a struggling student. This was back in 1998. I knew nothing about our movement, but I had come from a psychiatrized past, and I was very ashamed of that. I had moved across the country for school. I didn't know anybody. There was no, peer support at my university, so I was in distress, and I ended up in the University Counseling Center. Went in to see the counselor. They said, I told them my history with, my past and, my family history with my parents, and they said, you need to be on meds. We need to get a consult ASAP. And I was a little, I don't know, that hadn't worked so well for me in the past. And the woman said, look, just read this book, Listening to Prozac by Peter Kramer. Just read this book and you'll be convinced. And so I went, like a good little patient, I went seeking out this book, and instead I found Talking Back to Prozac by Peter Bregan, very different Peter. And that was the happy accident. It was literally one book on a shelf that put me on a whole other trajectory. And I was talking with somebody about this right before we came in here. it's like this paradigm shift that happens when you're like, my God, there's a whole reality out there that I knew nothing about. And one of the first places I reached out to actually was NEC to find out about recovery and our movement. I called the 1-800 number, I talked to Lori, and just to get that validation was huge of my experiences, my family's experiences. It was truly a completely life-changing experience. So I went from being a desolate graduate student to an angry activist. And I'm so blessed, it's been 3 years now, a little over 3 years that I'm working with NEC, 10 years that I'm part of this movement. And I can't think of any other work I'd rather be doing, but it does, as other people have mentioned, it often feels like the Sisyphean task trying to, counter the, big pharma and the psychiatric industry and, one after one, the powerful celebrities who get up and, smash everything that we're trying to say by embracing this, drug and illness paradigm. But at NEC, I just feel so blessed that I can be, a small part of the solution. And there are times that I'm answering the 1-800 line now and being able to kind of be on the other side and listen to others and validate them and having them say, this is the first time anybody's ever taken me seriously and listened to me and validated me, and that's a shame. That's a shame that they've gone this far in their lives, without that. So I feel like we really are at this point kind of a bit of an underground railroad. We're trying to funnel hope into this hopelessly messed up world. Dan speaks a lot about transforming our anger and transforming it into passion, a passion for life, a passion for change, a passion to build a different kind of world. And I find myself going in and out of that. But what I'd really like to see in the next 20 years is to not have people discover us by accident. I feel like so many people I've talked to said, oh, if it wasn't for this person or that circumstance, I would have never found out about this movement. I would have just ended up a patient for the rest of my life without any hope for recovering a life. So I'd really like to have our message be out there and be as accessible as all of the medical model messaging is. And I guess because I'm a words and communication person, but I want that to be something that you can't miss, that there are holistic alternatives out there. There's peer support. There is a real life for you. You're not defined by your labels and your diagnosis, and you have choices and you have options. And there's a life out there waiting for you. So that's the kind of world that I want to see for my child as well. And I'm just so grateful that you all are here, and thank you for coming here to celebrate with us. And I'll be quiet so we can get to the awesome performance.
I'm Oryx Cohen, and I'm the technical assistance, fairly new technical assistance center director. How I actually first heard about NEC was when I was right out of the hospital the first time, out of the hospital, and I was just searching for things and alternatives, and I found the NEC number, and I called, and Lori Ahern answered, similar to Leah, and just validated everything I was going through and saying, there is hope. You can live the life you want. Lots of people believe that recovery is possible and things like that, and it was a huge moment for me in my journey, and I've been really lucky to have just a great experience with recovery and a family and children now, and working at NEC is a big part of my wellness too. And as far as a vision for the future, I would hope that at some point in the future, places like the NEC will have people that can be advisors just to the general community, that we're building community, and that when people go through emotional distress, that it's not a medical model or a mental health system that helps people through those situations. It's families, it's neighbors, it's community. We realize that these are human experiences and that we can help each other through them. And that we don't fear altered states of consciousness, that we try to learn from them as our teachers. That's my big dream.
This is how we do it.